state's newest mass vaccination site, as we've been reporting, is getting more shots and more staff from the federal government. Here to explain what that could mean for your health and much more, Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester. Doctor, thank you so much for joining us. We always appreciate it. Governor Baker says FEMA is going to begin delivering an extra 6,000 doses a day to the Hines. You do sit on the state's vaccine advisory board. We want to remind people about that. So what does our vaccine supply look like right now? Is it bigger than you expected?
So we're still limited by the number of doses available. So it's great news that the federal government is able to supply us with more doses, and I'm confident we'll be able to deliver what they supply. So far the block has been only an available vaccine.
So today is Friday, March 26th, and as you know, the state's vaccine supply becomes available to all adults on April 19th. Do you believe there is now an infrastructure in place to meet that demand?
Yes, the state has reacted to many of the earlier issues and is employing a variety of different ways to get the vaccine to the community, including max vaccination sites, as well as distributions to local health departments and community vaccination sites. This should help us get the vaccine out to everyone, including underserved communities and people at high risk, I think, for serious disease.
That's great news. So we know that there is a race, though, right now between vaccinations and those variants that we keep reporting on. Do you think that the state should and really could even consider moving up that April 19th date?
Again, so far we've been limited by supply, not demand or distribution. So if there were more supply coming, I think the state would find a way to distribute it faster. We're certainly not holding on to the vaccine.
Earlier this week, Massachusetts downgraded its travel order to an advisory just weeks before the start of spring break for most public school students. So the question is, do you have any concerns about the timing of that decision?
Well, I think that we need to be somewhat concerned. The fastest way to end this pandemic is to get the vaccine to everyone. And I think the best thing for us to do as a community at this point is to try to limit the spread of virus as much as we can. The virus wants to spread as fast as it can. It doesn't have a master plan, and therefore it's likely there will be differences between different communities. And one worries that travel between different communities could lead to spread of the vaccine. So I don't think people should take risks that are not necessary.
Are you discouraged more by the rise in cases, or are you encouraged more by the fact that roughly 2.75 million people a day are getting the vaccine?
Well, if we want to look at it as a glass half full, and it is certainly spring, I think the numbers of vaccines are very heartening. I think we should be careful. We're at a point where if there were another surge, we would be hurt badly, and I think we need to not do risky things. I think we need to continue to obey masking recommendations as well as social distancing and careful washing of hands. That's what I would advise. As spring comes, I still think we need to be careful to avoid spread.
All right, Dr. Robert Finberg, professor of medicine at UMass Medical School in Worcester. Doctor, thank you so much for joining us as you do every Friday. We really appreciate it.
Thanks, Doctor. Have a great weekend.